Welcome back, deep divers. Today we're taking a look at substernal goiters.
Yeah, a condition many people may not have even heard of.
Exactly, but it's important stuff. We got to understand these things, what they are, what kind of problems they cause.
And how doctors even figure out what's going on.
So imagine this, right? You're bending over just to tie your shoes, or maybe reaching for something like way up on a shelf, and suddenly you just can't catch your breath.
And you think, oh, I'm just getting older.
Yeah.
But it could actually be something else. It could be a substernal goiter.
Okay, hold on. Back up a sec. We all know the thyroid's in the neck, right?
Right.
So how's that connected to trouble breathing when I'm reaching for a cereal box?
Well, so the thyroid, sometimes it can grow too large. We call that a goiter.
Okay.
And sometimes that goiter can start pushing down into the chest.
To the chest.
Yeah, that's what we call a substernal goiter.
Huh. That sounds kind of crowded, to be honest. Like, there's only so much space in there.
That's exactly the problem. The chest cavity, especially the area behind the breastbone, that's not really meant for a rogue thyroid.
Yeah.
So when it pushes down there, it can start pressing on things.
Like what? What kinds of things?
Important things. The windpipe, blood vessels, even nerves.
Whoa. Okay, so this isn't just a lump in the neck anymore. We're talking about a whole other region of the body.
Exactly. And because of that, the symptoms can be all over the place, which can make it tough to diagnose.
Okay, so walk me through this. What are we talking about, symptom-wise?
Well, most commonly, people will experience shortness of breath,
Okay.
especially when they're exerting themselves. But there's a specific type of breathing difficulty that can be a real red flag. We call it positional dyspnea.
Positional dyspnea, what's that?
Basically, it means you have trouble breathing in certain positions,
Okay.
like if you're bending over or reaching overhead.
So, like, when I'm trying to grab that cereal box on the top shelf and I can't breathe, that might be more than just, me being out of shape.
It might be. It happens because the goiter is pressing on the windpipe, and that pressure changes depending on your position.
Oh, I see. So what else? What other signs should people watch out for?
Well, a substernal goiter can also cause coughing, hoarseness, or difficulty swallowing.
Really? All that from a thyroid pushing down into the chest?
Yep, all of that can be from the goiter pressing on those structures in the neck and chest.
Man, the body is wild.
It is.
But, okay, say I'm starting to experience some of this. How do I even know if that's what's going on? Can you feel a substernal goiter?
Sometimes. The first thing a doctor will do is a physical exam. They'll feel around the neck and chest to see if there's anything unusual.
Okay, so like they're just feeling around for lumps, basically.
Right. But sometimes a substernal goiter can be tough to detect just by touch. Especially if it's really deep in there, that's when we need to turn to technology.
So we're talking about like x-rays, scans, things like that.
Exactly. CT scans and MRIs are incredibly helpful. They let doctors see exactly what's going on in there.
Wow, it's crazy that we can basically see inside the body like that.
It is pretty amazing.
Okay, so we've got the physical exam and then the scans. Is that all for diagnosis?
Well, not quite. Blood tests are also crucial. We need to check your thyroid hormone levels.
Why? Because even though the goiter's way down in the chest, it can still mess with the thyroid up in the neck.
Precisely.
Wow, that's wild.
And to figure out how bad the breathing problems are, doctors might use a test called a flow volume loop. It measures how air flows in and out of your lungs.
Interesting. I've got to ask, though, when it comes to goiters, is there always that fear of cancer? I mean, it's a growth, right? It's natural to be concerned.
Oh, absolutely. It's a big concern for both patients and doctors.
Mhm.
And, well, while most substernal goiters are benign, non-cancerous,
Yeah.
there's always a chance it could be malignant.
Okay, so then what happens? How do they figure that out?
Well, they look at your medical history, the symptoms you're having, and what they find in the exam and imaging. Sometimes they need to do a biopsy.
A biopsy? What's that exactly?
It's basically taking a small sample of tissue from the goiter and looking at it under a microscope.
So like a little sneak peek to see what's going on in there.
Exactly.
Mm.
And that tells us whether the cells are cancerous or not.
Okay, that makes sense. It gives them a definitive answer.
Right. And that information is crucial when it comes to deciding on treatment.
Okay, so we know a biopsy can tell us if a substernal goiter is cancerous or not. But what if it is? What happens then?
Well, then the focus shifts to treatment and management. And luckily, medical science is always coming up with new ways to tackle these situations.
So I'm guessing the treatment plan depends on the type of cancer we're talking about and how far it's spread.
Exactly. It's all about tailoring the treatment to the specific case. Often, the primary approach is surgery.
Okay, makes sense.
That might mean removing all or part of the thyroid gland.
So basically, getting rid of the problem at the source.
Right. And sometimes, depending on the situation, radiation therapy or chemotherapy might be recommended as well.
Wow, it sounds like a lot to deal with. I know medical advancements have come a long way, but it's still got to be pretty daunting for patients.
Absolutely. It's a tough journey, no doubt. It takes strength and resilience.
Yeah.
But it's important to remember that with early detection and the right treatment, the outlook for many thyroid cancers is actually quite positive.
That's good to hear. Now I'm curious, are substernal goiters becoming more common, or have they always been around, just harder to detect in the past?
That's a great question, and it's something researchers are looking into. We don't have definitive data on whether the incidence is actually increasing, but we are probably finding more of them now because of those improved imaging techniques we talked about.
Right, with technology constantly evolving, we're able to see things we might have missed before. Makes sense.
Exactly.
So speaking of advancements, what's on the horizon in terms of treatment? You mentioned minimally invasive surgery earlier. What does that involve?
Oh, minimally invasive surgery is a game changer for a lot of conditions, including substernal goiters. Instead of making big incisions, surgeons use tiny instruments and cameras inserted through small openings.
So less cutting and poking. Sounds good to me.
Right. The benefits are huge. Smaller incisions mean less pain and a faster recovery. Plus, we're seeing incredible progress with robotic surgery.
Robotic surgery.
Yeah, surgeons use robotic arms to perform complex procedures with amazing precision. It's pretty sci-fi, actually.
I've heard about it being used for other things, but to think it could be used for something as delicate as thyroid surgery, that's amazing.
It really is. Imagine, in the future, removing a substernal goiter through just a few tiny incisions, with the patient back on their feet in just a few days. That's where we're headed.
Wow, that's incredible. Sounds like we're on the brink of some major breakthroughs. But even with all these advancements, prevention is still key, right? What can people do to keep their thyroids healthy and hopefully avoid these issues altogether?
Absolutely.
Yeah.
While we can't eliminate the risk entirely, there are definitely things we can do to support thyroid health. One of the most important is making sure we're getting enough iodine in our diets.
Iodine. I know that's important for the thyroid, but what does it actually do?
Iodine is a mineral. The thyroid uses it to produce hormones that regulate things like metabolism, growth, and development. So without enough iodine, the thyroid can't function properly.
Got it. So where do we get iodine? Is it just iodized salt?
Iodized salt is a good source, but it's important to check labels because not all salt is iodized. You can also find iodine in seafood, dairy products, and some fruits and vegetables.
So as always, a balanced diet is key. Are there any other lifestyle factors that play a role in thyroid health?
For sure. Maintaining a healthy weight and managing stress are important too. Chronic stress can throw off your hormone balance, which can impact the thyroid.
It seems like stress is at the root of so many health issues. It's a good reminder to prioritize self-care and stress management.
You're absolutely right. Taking care of ourselves holistically can go a long way in supporting thyroid health and hopefully reduce the risk of developing goiters in the first place.
This is all great information, but before we move on, what about the future of diagnosis? Can we expect any big advancements in how substernal goiters are detected?
That's a great question. Early detection is the goal, right? And researchers are definitely working on developing more sophisticated tools.
Like what? Give us a sneak peek into the future.
Well, imagine a future where a simple blood test could reveal tiny changes in thyroid function. Changes that signal the presence of a substernal goiter before any symptoms even show up.
Wow, that would be game-changing. Catching it early could make such a difference. Anything else on the horizon?
We're also exploring advanced imaging techniques that can detect minute changes in thyroid tissue for even more precise and early diagnosis. Think of it like having a high-definition map of your thyroid. That would allow doctors to spot potential problems with incredible accuracy.
It's amazing how far medical technology has come. But it's not all about fancy equipment, is it? What about the human element of diagnosis?
You're right, technology is a powerful tool. But we can't forget about the importance of the doctor-patient relationship. Having a doctor who really listens to their patients, understands their concerns, and carefully considers all the pieces of the puzzle is invaluable.
Absolutely. That trust and open communication with your doctor is essential for receiving the best possible care. So we've covered prevention, diagnosis, and treatment. But I feel like there's more to the story. What else can you tell us about the world of substernal goiters?
You know, there's one more thing I think we should touch on before we wrap up, the psychological impact of this condition. It's not just about the physical symptoms, it's also about how those symptoms can affect a person's mental and emotional well-being.
That's a really important point. Imagine dealing with shortness of breath and not knowing why. It must be so stressful.
It can be very anxiety-provoking. And then there's the fear of cancer, which adds another layer of emotional burden. It's crucial for patients to have access to support systems and resources to help them cope with these challenges.
That makes sense. Are there specific support groups or organizations that people can turn to?
Absolutely. There are many organizations dedicated to thyroid health that offer valuable information, support groups, and resources for patients and their families. They can provide a sense of community and understanding that can make a big difference during a challenging time.
It sounds like connecting with others who have gone through similar experiences can be so helpful. Knowledge is power, but so is feeling supported and understood.
Exactly. And that brings us to another key takeaway I want to emphasize. While we've covered a lot of technical information today, it's important to remember that each person's experience with a substernal goiter is unique.
What do you mean by that?
Well, the symptoms can be so different from person to person. The diagnostic process can vary, and the treatment plan is always personalized. There's no one-size-fits-all approach.
So it's not just about understanding the science, it's about recognizing the human side of this condition.
Exactly. It's about understanding that everyone's journey is different and respecting the individual needs and experiences of people dealing with substernal goiters.
That's a powerful message. It reminds us that behind all the medical terms and scientific advancements, there are real people going through difficult challenges. Wow, we've really covered a lot of ground today. It's amazing to think about all the complexities involved with substernal goiters.
Yeah, it's a fascinating condition.
Definitely. And I feel like we've really gone deep.
We have from anatomy to symptoms, diagnosis, and treatment.
We even got a sneak peek into the future of all that.
And don't forget, we talked about prevention, early detection, and the psychological impact, too.
Right, right. So much to consider. But before we wrap things up, I want to bring it back to our listeners. What's the one key takeaway you want them to remember from today's deep dive?
If I had to pick just one,
Yeah.
I'd say it's this. Be your own health advocate.
I love that. Knowledge is power, right?
Absolutely. Understanding how your body works, knowing what to look out for, taking those proactive steps, that can make all the difference.
So true. So for our listeners out there, if you're experiencing anything unusual like shortness of breath, trouble swallowing, hoarseness, anything like that, don't wait. Talk to your doctor.
Right. It's always better to be safe than sorry. Especially with substernal goiters, early detection is so important. And a good doctor will listen to your concerns and help you figure out the next steps.
It's funny. After learning about all this, I've become super aware of every little twinge in my neck.
I get it. It's normal to pay more attention to our bodies when we learn about potential problems.
Yeah, I'm like, wait, is that normal? Or is that a goiter starting? Should I be worried?
Well, it's all about finding that balance between being informed and not freaking out over every little thing.
Exactly. Stay aware, but don't drive yourself crazy.
Right. Trust your body, listen to what it's telling you, and if something feels off, then get it checked out.
Great advice. Well, I think that just about wraps up our deep dive for today. What a journey.
It has been a fascinating one, I'd say.
Totally agree. I don't know about you, but I'm feeling pretty informed and a little bit empowered, too.
Me too.
A huge thank you to you for taking the time to break it all down for us.
My pleasure. Happy to do it.
And to all our listeners, thank you for joining us on this deep dive into the world of substernal goiters. Until next time, stay curious, stay informed, and most importantly, take care of yourselves.